MMT Trunk rotation, external and internal obliques. Position the patient supine with the hands clasped behind the head and the legs straight. Stand at the side of the patient at waist level. Due to the difficulty of passively moving the trunk through flexion, you do not assess the available range of motion in the trunk. In patient-appropriate language, ask the patient to clasp the hands behind the head and rotate the trunk to one side until the inferior angle of the scapula clears the table. This movement is then repeated to the opposite side. Common substitutions include going into more trunk flexion than rotation and protraction of the scapula. Make sure the patient does not pull on the neck with the hands. It may be necessary to have only the fingertips support the head rather than the clasped hands. The patient must maintain the shoulder abducted so that the elbows point outward. Do not allow the elbows to come in. Please note that it's not necessary to have the patient perform this active motion twice if no substitutions are observed on the first attempt. You may continue with the test at this point. After correcting any substitutions, ask the patient to perform the motion as previously. The resistance in this test comes from the weight of the patient's trunk and various positions of the patient's arms. Grade 5, normal. The patient completes range of motion in trunk rotation with the hands behind the head until the inferior angle of the scapula clears the table. The patient must maintain this position for a 5-second count. For grade 4, have the patient cross the arms over the chest. Grade 4, good. The patient completes range of motion in trunk rotation with the arms crossed over the chest until the inferior angle of the scapula clears the table. The patient must maintain this position for a 5-second count. For grade 3, have the patient fully extend the arms in a plane slightly above the body. Grade 3, fair. The patient completes range of motion in trunk rotation with the arms outstretched until the inferior angle of the scapula clears the table. The patient must maintain this position for a 5-second count. Grade 2, poor. The patient completes partial range of motion in trunk rotation. The inferior angle of the scapula do not clear the table. For grades 1 and 0, reposition the patient so the knees are flexed with the feet flat on the table. For grade 1, you must now palpate the external and internal obliques. When the right shoulder goes to the left knee, the right external obliques and the left internal obliques are working. When the left shoulder goes to the right knee, the left external obliques and the right internal obliques are working. When the patient rotates to one side, the internal oblique muscle is palpated on the side toward the turn. The external oblique muscle is palpated on the side away from the direction of the turning. Instruct the patient to attempt trunk rotation. Grade 1, trace, palpable contractile activity with no movement. Grade 0, no palpable contraction.